Thank you so much for joining us today. Really excited about today's Facebook chat. My name is Megan Collier. I'm with the Texas Tech University Health Sciences Center Marketing and Communications team. Our special guest today is Dr. Lori Rice-Spearman, the Texas Tech University Health Sciences Center Interim President. Thank you so much for being with us today.
Thank you, Megan. Thank you for inviting me in today.
Well, we know you now as your role as our interim president. I do want to, though, get sort of a snapshot of your background and what you did before being in that leadership role. Can you kind of tell us about your tech journey?
Absolutely. So my journey is probably a little unique compared to some. I was actually in the very first class of clinical laboratory science students who graduated from the Health Sciences Center over 30 years ago. So I started my student journey here back when the building had just been opened, and we were moving into the building and getting into all the clinic and teaching spaces. And then I did a short stint for the time period that was called Methodist at the time, and now it's called Covenant, and worked there. And then I was asked to come back and join here in 1987. And have worked my way up the ranks. My background has always been in clinical laboratory science or diagnostic laboratory science, diagnostic side of medicine, and that's my love, is that background.
Has it been nice to kind of watch that journey grow since you've been kind of at the beginning and now you're here? I mean, what a wonderful story, a full circle story, really, right?
Oh yes, I walk the halls here every day and remember what it was like to be here as a student. And I have such fond memories of my classmates and what they've gone on to do, students that I've had the privilege to teach over the last 3 decades, and how they're contributing and what they're doing. So I consider myself very fortunate to have been in the same institution for this long.
So let's talk a little bit more about what clinical laboratory science looks like, what that is. And before we talk specifically about it, what it looks like during COVID-19, let's just talk about it in normal times, right? What does that look like on a normal basis?
So a clinical laboratory scientist is trained in the diagnostic side of medicine. So anytime a clinician is making a diagnosis, it ranges anywhere from 70 to 75% of the information that they gain for diagnosis and treatment comes from the clinical laboratory. So there are individuals in the clinical laboratory who receive higher education training, they have degrees, and then they go on to sit for national certification or license exams depending on where they practice. My certification is with the American Society of Clinical Pathology, and we have different content areas within the profession. Immunohematology, which is blood banking or blood, when you get blood and blood matched for surgeries. Also clinical hematology, all the blood diseases, what it looks like in a normal state, in a disease state. Microbiology or infectious disease, which happens to be my area. And then also we have clinical chemistry, and then we also have immunology. So those are some of the basic areas within our profession.
So for somebody with an interest in infectious disease, this has to be a really sort of fascinating time to be witnessing, right?
Oh, absolutely. It really is very interesting, having been particularly in the area of microbiology and infectious disease for over 3 decades, to see the different diseases that have happened over the course of these 3 decades and how they've impacted our communities. When I was training, HIV had just come into the scene, and it completely changed the way that we practiced and we functioned within the clinical laboratory. And so now to have a similar experience again with COVID-19 is very interesting in my career development.
So what does the role, how does that role look like now? What are people doing now in that profession?
So right now in our profession, we've gone from a history over 30 years from very what we call hands-on manual techniques. So when you think of a chemistry lab or your brother or your sister's chemistry set with test tubes and those and pipettes, we really started moving towards a very high functioning instrument heavy molecular pathology, a very sophisticated clinical laboratory. And so these individuals really have to have very high levels of training to be able to run these instruments, understand how they work, interpret these types of tests. It's really an exciting time to be in the field of clinical laboratory science.
Well, let's talk a little bit about COVID testing. I think a lot of people are unsure what that looks like, for, actually getting the test itself. Does it hurt? Does it take a long time? Why are there different times, that it takes to get the results back? There's a lot of variance involved in it right now. And I think people have a lot of questions just about what it looks like in general. Can you kind of help us there?
Absolutely. So let's start with categorizing two different types of testing. So the testing that you're hearing the most about right now is the diagnostic testing. And that's where we collect a nasal swab. It's called a nasopharyngeal swab, or perhaps a throat culture, or even a sputum specimen, something that you cough up from your lungs. It's put in some transport media. It's transported to the laboratory. It's taken into the laboratory, and then it goes through a very sophisticated series of tests. And we call that the diagnostic side of COVID-19. That's the one that you've heard a lot about in the media for the last 4 to 6 weeks here in the US. The latest statistic I heard was we're finally at a point where we're getting testing going. It was a little slow initially, but now we've had over 2 million tests run in the US. So it's starting to loosen up, and we're starting to get more and more testing happening on the diagnostic side. Now then, the next side of testing that you're probably going to start hearing more about is we had our first FDA-approved serologic test. And that's the test that we're going to use to determine if you've already had the disease. Mm-hmm. So for all of those individuals out there who are having very mild symptoms, or in some cases asymptomatic symptoms, we're going to be able to test them and see if they produced antibody to the disease, so we'll know if they're a carrier or if they've already had the disease. And this is going to be the part B of us being able to fight the COVID-19 pandemic.
It does feel like there's a lot of interest on that Part B front right now. Don't you agree?
Yes, absolutely. Some of the countries that have been successful in dampening that curve and really isolating these cases are the ones that have been able to do the serologic testing and identify those asymptomatic carriers, or those individuals who have already had the disease, and really isolate those pockets of a potential infection.
Such a fascinating time to be in medicine, for sure.
Absolutely.
And to be at the university level as well. So what is the involvement for Texas Tech University Health Sciences Center in COVID-19 testing? What are you seeing out there? How are we helping the community?
So about 4 weeks ago, we reached out to our TI lab, which is part of our Department of Environmental Health lab, led by some fantastic scientists out there. And we knew that we had here at the HSC the expertise in high throughput diagnostic patient testing. And so we partnered with them with their technical background in a BSL-3 lab. This is a BSL-2 assay, but they have a BSL-3 lab. And we formed this great partnership with them between TTUHSC and TTU, and started really being able to ramp up the capacity of that laboratory and bring in some technology that wasn't previously there, that's allowing us to really serve 67 counties in Texas and get testing done and testing reported back out. And really that's what's important, is right now we're testing the sick, mm-hmm. and trying to get that information as quickly as we can back to those communities. I know at one point they had less than a 24-hour turnaround time getting that information back to the county and city health officials.
So important. Such a difference, It's
Absolutely.
wonderful to be a part of this organization. Anything else you kind of want to add to the conversation before we get to our fun part of our interview?
Well, but before we get to the fun part, I just want to take an opportunity to share with this group that will be signing on to watch this, is we are at a critical point in slowing down this disease. And so I just hope that everyone will take seriously our desire and our need to social distance and to protect ourselves and our families. And it would be so easy right now for us to let up and think, oh, it's slowing down, it's not as serious as it was. Well, there's a reason it's slowing down, and that's because we're being so careful as a community and those that are going to be watching this. So keep up the good work. Don't let up. let's continue to be persistent, and that would be the message that I would want to send today.
Wonderful. Really, really important information. This information, while I think is exciting, it might not be as critically important, but we're going to do it anyway. Okay. Does that sound like a plan?
That
okay.
Sounds like a plan.
First question that we've asked everybody. This is a hard one.
Okay.
Crunchy or smooth?
Oh, crunchy. We're talking peanut butter, right?
Well, I mean, that has been a follow-up question for a couple of people. We didn't realize that that might be a problem, but yes, we are talking about peanut butter in theory.
Yes,
you're a crunchy gal. Okay, all right. Favorite ice cream flavor?
Oh, chocolate.
Nothing in it, just plain smooth chocolate, huh?
Just classic. I'm a classic.
Right. Okay, we can go with that. Now here's a Texas Panhandle or West Texas question for you. Chili with or without beans?
Oh, without.
You're
Texas
a purist.
chili. It's
You're
without.
A purist. That's all right. Anything that you're binging right now, maybe during your quarantine, that you're on maybe Netflix or Hulu or whatever.
Well, okay, I guess I'll admit my husband and I did last weekend finish watching The Tiger King.
Oh, wonderful. Well,
oh my. All I can say is, oh my.
There's a lot to unpack, that is for sure.
Yes.
You know, there was an additional episode recently released, so you can check that out.
Oh, okay.
There's more good pleasure for you. Okay, last question. First concert you ever attended?
Chicago.
Good one. I like it. I like it. That's a great one. It was
phenomenal. Mm-hmm.
Do you remember what city?
Midland, Texas.
There you go, girl. All right.
Yeah.
Dr. Lori Rice-Spearman, thank you so much for being with us today.
Thank you so much.
We appreciate your time.
Bye-bye.